Director of Communications. So, what kind of injuries did you see coming into the hospital, Mr. Godbold?
Well, I didn't see them when they came to the emergency department, and all I can really tell you is that they were gunshot wounds, and one of the patients is in critical condition, indicating a serious gunshot wound. 2 patients were in surgery immediately. One's being prepped for surgery now, but the other 2 patients are listed right now in serious condition, so not quite as seriously injured as the one in critical.
Okay. Now, how far is your hospital from the community college?
I think we're roughly 75 miles north, right on Interstate 5 from the Roseburg area.
And all of the wounded were put in medevac helicopters taken into your facility?
No, we just received 3 patients, and the 3 that we did receive, 2 came by helicopter and 1 by a fixed-wing aircraft.
Did the patients say anything to hospital officials or the doctors or the nurses?
Not that I've been told.
Okay. So basically you have one person, critical condition, fighting for his, is it a his or a her? Do you know?
It's 3 female patients ranging in age from 18 to 34.
Wow. 1 fighting for her life, and then 2 that are stable right now. Is that the condition that we have?
Well, serious doesn't indicate stable. It indicates that you know, they're still in very dicey medical shape. So, but they're not critical, which indicates they're all in the intensive care unit. That's another good way of saying it.
When someone is in critical care, the one woman who is fighting for her life, is she in surgery now?
I'm not sure which patients are in surgery. One has just come out of surgery, one's still in surgery and has been for some time, and one is being prepped to go into surgery and may be in there now.
Does your hospital specialize in this kind of trauma?
Well, we're a level 2 trauma center, so we're equipped to provide all of the services that are necessary to care for this kind of trauma. Sure, absolutely. In fact, you know, we see gunshot wounds all the time in our emergency department.
How do you see them? Are they accidental or are they criminal acts?
Well, both.
So,
attempted suicide, criminal acts, accidental shooting.
Now, there's going to be a big focus put on the gun issue in your community and probably the entire state of Oregon. Do you feel that is a fair situation?
Well, that's not really my area of expertise, Bill.
Okay, so you don't want to comment on it. I don't blame you. So right now, 1 is fighting for her life. 2 are not critical, though, right? You don't have them in critical condition.
Right. This condition, serious means that their vital signs may be unstable or outside of normal limits, and they're acutely ill.
Okay. Well, it's a damn shame. It really is that these kids and these people have to go through this. All right.
Here too. 2 of the victims' families have made it to our hospital at Riverbend, and we're taking care of them here too.
And have they said anything to you, Mr. Godbold, about the women who were shot? Have the family said anything to you?
Not yet. We're just having the clinicians who are caring for their patients and our pastoral care team talk with them right now.
Interesting. Pastoral care team. What is that made of?
Those are chaplains and counselors who specialize in people who are going through a traumatic, stressful event as a result of needing to come to a hospital, and they have expertise in how to listen to people and talk to them about what they're feeling and going through.
Now, the families have not been able to see the 3 patients, is that correct?
I don't know that. If they were in surgery, of course, not until they got out of the recovery room.
If they're not conscious, do you let the families just see that they're okay?
That's kind of done on a case-by-case basis, depending upon what the physician and the team caring for the patient think is best.
All right. Scott, well, thanks very much for taking the time. I know you're very busy tonight. In a moment, college campuses, are they dangerous places these days?
Yeah.
Right back with it.
Wow, he did a good job on that interview. Very professional.